I'm Dr. John Wilson. I'm Associate Professor of Neurological Surgery here at Wake Forest Baptist Health. There are a number of different types of brain tumors that occur in individuals. There are tumors that arise from within the substance of the brain. Those kinds of tumors can range from relatively benign to malignant or even metastatic tumors. And then there are tumors that arise outside of the brain itself and push into the brain. Those tumors generally arise either from the lining of the surface of the brain, called the meninges, or the nerves that are at the base of the brain. Within our department, we are all fairly subspecialized, so that I, for example, will specialize in the treatment of the tumors that arise at the skull base. These are oftentimes benign tumors, tumors called meningiomas that arise from the lining of the brain, or tumors that arise from the nerves that are leaving the brain stem. These are oftentimes called schwannomas. There are sometimes cancers that bridge the space from the inside of the cranial cavity to the outside of the cranial cavity, and those are something that I would also treat as a skull-based tumor. These tumors are somewhat challenging in terms of their surgical treatment. The reason for this is that at the base of the skull, that is where all the arteries and veins enter and leave the skull to feed the brain. That is also where a number of important nerves exit and enter the skull. Nerves that control things such as your vision, such as the ability to move your eyes and focus your eyes, the ability to move your face, feel your face, swallow, phonate. All these sorts of things can be controlled by these blood vessels and nerves that are entering and leaving through the skull base. So tumors that arise at the base of the skull inherently involve those structures. Those structures are all very critically important. They are all very difficult to gain access to try to remove tumors from around them without doing damage to them. These tumors are oftentimes approached via a team approach, and that's one of the things that we have really a particularly strong emphasis on here at Wake Forest Baptist Health is the team approach to the treatment of these skull-based tumors.